my name is Anna Enan, and I am a MSND DI student at Eastern Illinois University. And today I'm going to talk to you about my oral abstract for my systematic review that I will be presenting at a future date. So I first just want to focus on the purpose of my systematic review and just give everybody a good idea of what I'm going to be elaborating on further shortly in my systematic review presentation. So the purpose of the review is to determine the effect of the Mediterranean diet on cognitive function in older adults, and more specifically I'm going to focus on the cognitive decline such as Alzheimer's disease and dementia, and just determining whether the Mediterranean diet is protective against getting Alzheimer's disease and dementia in adults. So I will elaborate on this further in the next slides. So because of the rise of the aging population due to the baby boomers turning 65 recently, there has also been a rise in chronic disease and chronic illness. Aging is a major risk factor in developing neurodegenerative diseases like dementia, and Alzheimer's disease is the most common form of dementia. In fact, 40 to 50 million people in the world are currently living with dementia. That's quite a statistic. And unfortunately, there's no cure or treatment to alter the course of the disease. There are some drugs that do help to aid in the progression of Alzheimer's disease, but there's nothing that will stop it from happening, or once it does happen, reverse it from going further. So in this systematic review, we're trying to determine whether Mediterranean diet could be a modifiable risk factor in stopping Alzheimer's disease from happening altogether or progressing at all. I just want to explain what the Mediterranean diet is in case some of you don't know. I'm sure most of you do, but just so we're all on the same page, when I do refer to the Mediterranean diet in my systematic review, I want everybody to just have a good idea of what it entails. So the Mediterranean diet is characterized by eating a high consumption of fruits and vegetables, legumes, and grains or cereals, monounsaturated fatty acids such as olive oil, which is usually the main fat or lipid, moderate consumption of alcohol, so that's mainly wine, and usually only during meals that's consumed, and then a low consumption of red meat and dairy products. It's an anti-inflammatory diet. It also is high in antioxidants due to the high consumption of fruits and vegetables, so it does help to fight off inflammation and free radicals as well. I also want to dive into the relationships between cardiovascular health and the Mediterranean diet. There's much research out there about the effects of the Mediterranean diet on cardiovascular health and how it can actually help to lower blood pressure and blood cholesterol levels. I'm sure most of you know that as well. And then we all know that our cardiovascular system and our brain have that connection with the arteries. So it only makes sense that, and the research shows that when we eat things that clog our arteries, it can have a detrimental effect on our cardiovascular system and on our brain health. And it only makes sense that that our cognitive function or health and the Mediterranean diet would also have a positive relationship, and that the Mediterranean diet can help to reduce cognitive decline and can fight off the inflammation and the free radicals that affect our brain health. So that is an important relationship to be aware of as we continue on in this review. So I conducted a search on the Mediterranean diet and cognitive health or function in 4 different databases and came up with many results. 10 of those articles have been used in the systematic review to determine whether the Mediterranean diet can aid in the prevention of cognitive dysfunction or decline. Within those articles, they were from 2009 or more recent than that. They were peer-reviewed articles, and every article had to describe the Mediterranean diet, and also the participants had to be 55 years or older. and they could not have any prior cognitive delays or dysfunction. One of the reasons why I decided to research this topic is because Alzheimer's disease actually runs in my family, and I've actually had 2 male relatives who have had Alzheimer's disease, and one of my fears is that my dad gets Alzheimer's disease. So, if we can determine whether the Mediterranean diet is a protective factor against Alzheimer's disease or dementia, that would be incredible, and I think it would be groundbreaking to determine if that diet is sufficient in order to prevent Alzheimer's disease and dementia from occurring. So in my systematic review presentation, I will elaborate more on the background and talk more about that. I will also talk about the methods in more depth so you can get a better understanding of how I retrieved my sources. And then I'll also talk about the results of the sources and talk about trends within those sources. And then I will provide the conclusion and the implications of the study. So stay tuned for my future presentation so that you can learn whether the Mediterranean diet has a protective effect against cognitive decline in older adults. And thank you so much. Have a great day.